and welcome. You're tuning in to Unbreakable Hope with me, your host, Jessica Rose. This podcast is all about seeking the light. In each episode, we chat with someone who has either overcome the darkness or who is actively spreading light within their own community. So let's jump into today's episode. I'm excited to introduce today's special guest. Brian Paul is the president and founder of Veterans for Life USA. And as a firefighter, EMT, and veteran in his past life, he is now being able to serve his fellow first responders, getting the help that they need, from addiction therapy to also PTSD treatment, and finding ways to be able to improve systems to better care for the people caring for us. Let's jump into today's episode. Well, thank you so much for being here and coming on as today's guest.
Absolutely, Jessica. Thank you so much for having me.
I would love to give you an opportunity to introduce yourself to our listeners and jump into our chat.
Yeah. So my name is Brian Paul, and I'm the president and founder of a OKC-based veterans nonprofit called Veterans for Life USA. We started back in May of 2017 after I served in the 45th Infantry for 6 years and jumped back into service again as a firefighter EMT for 8 years. Went through my own struggles with mental health and addiction to alcohol, went through a 90-day treatment program, came out the other side of that and just wanted to help the next person.
It's amazing how much people are able to give back after they've had lived experience. I think that's one of the things with Unbreakable Hope. We're seeing all these beacons of hope in their own communities doing all this good work because you've gone through stuff. And how cool is that to be able to say, hey, I've been in the military, I've been a paramedic, I've been EMS, I've been in these first responder fields that really need the extra love and support. What were some of the biggest challenges that you saw when you were working in those career fields, as far as you received a challenge and you needed support and maybe that support wasn't there? I know stigma is always a big topic when we talk about receiving support. So what did some of those challenges look like?
Well, the challenges were in the units I served in, both in military and in fire and EMS, is that we did a lot of training for how to go and be war fighters and how to go and put fires out and do CPR and all the things. But we received almost no training on how to take care of ourselves mentally. And if we do have the problems, where do we turn and what does that look like? So that, I would say, that's probably the biggest challenge. And then, as you mentioned just a minute ago, the stigma and that makes it really hard to open up and kind of even just get started on where do you look for help.
Yeah, and you've been able to partner with a lot of really amazing resources. I'm a firm believer that resources are like flavors of ice cream. We've got to find the one that works for us. And there's so many flavors out there and different brands. Sometimes we're too in it to really realize that there's resources to help. What were some of the things that actually got you in the path to being able to access or have the knowledge of the resources that ultimately ended up helping you, so now you can help others?
Well, when I left my addiction treatment program called English Mountain, I was actually there and there discovered that I actually had post-traumatic stress, and I was diagnosed with that, and I had no idea. Like, I knew I was drinking a lot, but I didn't know any of the underlying stuff, and so here we are. And so for me, I didn't know of any other programs other than the one I went to. So I didn't know there were things called veteran support organizations and treatment programs that specialize just in veteran and first responder community. So I just researched. I went and started touring different programs that I had heard about, and I just began learning. But really, primarily, the people who I learned the most from are the other people, the other veterans and the other firefighters, cops, paramedics that were currently still struggling. And I just asked them questions on how I can help them. And you receive a lot of knowledge from others, and so touring, putting in a lot of the groundwork. And here we are. We partner with four outpatient treatment partners. I'm sorry, three outpatient treatment partners, four inpatient treatment partners, and toured and met all the therapists all the people from the CEOs to the janitors to the people that are going through the program. And
One of the things that you mentioned that I think is so critical in so many aspects of life. This is something I experienced personally with my husband being in a wheelchair, running into ADA or handicap stalls and stuff. I'm like, you clearly did not consult with someone that actually has to use these things. So you said it, you said, I actually talked to the people in these fields and said, how can I help you? What would be a service to you? That's one thing that in the suicide prevention is our data. It has to be cleaned by the time we get it. It's 2, 3 years old. And now things have changed 2, 3 years. Like look back to 2020. We're going off of data that was 2, 3 years old that was not helpful during the pandemic. And now we're going off of data that happened during the pandemic, which is also not helpful for right now. And I think that's
yeah,
a valuable lesson so many people can learn is just asking and finding out what those people actually in the fields you're trying to serve need and want. What were some of the common themes or maybe specifics that people shared with you that they wanted or needed for help?
um, they primarily across the board is that people want to feel like they can share and be open with other people who get it, and they just want someone to sit with them while they talk without judgment in a safe place. And so what I like to do is just very, very, very briefly share just a 3 to 4 sentences about my story, so that hopefully that enables them to open up and be truthful with me. And then as they're talking, I'll ask them, in 45-minute long conversation, I'll ask them, do you have private insurance? Where do you live? And so what I'm doing is I'm getting them kind of in a direction of what resource or what program most closely matches their situation. And another thing I found that seems to work is helping them discover what their why is. Not my reason for them going or their wife or their spouse or their loved one, but what's their reason for going. And so let's talk about some interest that they have. What's important to them in their life? Maybe by just helping them discover the reason why we're going to treatment, then hey, now we have something to kind of build from.
Yeah, that why. Simon Sinek wrote a book about it. You just start with your why. And oftentimes I teach a suicide intervention intensive and people will say like during one of our scenarios like, "Oh, what about your kids?" And I'm like, "Eek. Kids may be one of their stressors." Well, what about your spouse? Eek. That could be one of the problems that have led them to a point of pain. So oftentimes we think that it's outside, and maybe it is. I'm not saying it's not because there's also a lot of people who are like, I live to be a grandma, whatever, great. But not making those assumptions. So I love that you're saying like, hey, what is your why to get better? But also what is it tied to you? Right? How are you going to get better? Because if we put our stock and value in other people, ultimately our deep buy-in isn't there. The other crazy thing is when we think about PTSD, you mentioned you were in this treatment facility and you were like, hey, that's how I actually found out I had PTSD. That 6 out of 100 people roughly in America have PTSD. And a lot of those are our first responders, but we expect them to be there when people are in crisis, whatever that looks like, to come in to, save the day medically or save the day, and as a police officer role, maybe having to break in and save somebody, all these different things. We want you to be there on the worst days of other people's lives, and then to just keep doing that, and to just keep storing that, and to keep holding that. We've learned a lot from the book The Body Keeps Score that it's still there. It doesn't just go away. Were there any kind of policies in these different hats that you wore in different employments? I'm not sure if we ever talked if you stayed in the same like firehouse or whatever, but within those, were there certain policies that were actually supportive, or were you seeing gaps in the system? Because let's be real, there's systems, there's generics, there's this is how we've always done it. but a lot of that needs to change to enhance our overall well-being. So, were there supportive things that you found, or were there gaps that you found that still need to be changed?
Yeah. Well, you kind of said it. That's how things have always been done. So, as a firefighter and EMT, my experience has been that from the time you go through the academy all the way through your career, you're always trained to see your captain. Okay, you have equipment problems, see your captain. You have a bad, a call or something, see your captain. You have training issues, see your captain. With mental health, we actually don't want them to see their captain. We want them to go to their HR rep, go in the office, close the door, and tell them the magic words, I need help. By doing that, as we know, it kind of gets around that culture and that stigma, because the firefighter or first responder is protected by HIPAA and other federal laws, where that HR rep by law cannot go to that captain and inform the crew and the chief, because a big sticking point in asking for help in our first responder community is the fear of being blackballed or not being promoted or being that guy on the shift that's maybe the weak link on the shift. And that's tough. That's tough to get through. So I think a lot of people are just doing what I did and just drinking it off at home. And as we know, it just makes the problems worse. So we want them to go to their HR rep and tell them, if you have a treatment program in mind, then that's wonderful. But that's a lot what Veterans 5 is here for. Is we've done that homework beforehand, and education is a big part of it as well, because a lot of people don't know that. They just know, go to your captain.
That's a really good point. It would definitely help with a lot of that. Remind me, when I was in the Marine Corps, I had a freak knee injury in boot camp that it turned into I'll just keep sucking it up, I'll keep sucking it up, which obviously, kept getting worse, ultimately resulted in additional injuries. But I kept going to medical, and it'd be like, oh, here's some meds, here's some meds. Oh, do a little PT. Oh, here's some light duty. So you kind of get this dubbed like, oh, the light duty queen, right? And I'm like, okay, well, I have an issue and it's just not being resolved. And ultimately, it took my gunny didn't know really anything about the Navy medicine side, didn't know what to do. But there was another gunny in my unit, and he said he knows. So he brought him in to help me. Literally massive, like 6'5", I want to say. Very tall, very big man, kicking indoors at the medical saying, hey, what is going on? Why has this been an issue and there hasn't been an MRI? And it's been almost 2 years. And it was just like getting someone to advocate for me, but hearing that all the time from people outside of my section in my unit. My section in my unit, when I started, they were amazing and very supportive. So I had great leadership. I had a great leader that's recognized I am not the knowledgeable person to help my Marine in the situation, but I know someone else who is. Let me bring them in to help. And that was ultimately what helped me actually get the support I needed on the Navy side. Then I switched sections in the Marine Corps, and unfortunately, my leaders were not supportive. They were very, well, you just need to get out. And I'm like, no, turns out I need a surgery, which ultimately resulted in 5 additional surgeries. So it's interesting, kind of like what you're saying when it comes to the mental health and behavioral health side too, is it also depends who's in that leadership role. So I love that. Go to HR, go outside of your leadership role, have somebody else that can help navigate for you, and then if it's appropriate, talking to leadership, saying, hey, we're working on this, whatever the case may be. But sometimes I think that there's people, I think we can all agree, there's people in job fields that shouldn't be there, but there's also people that get promoted that aren't leaders. And
Yeah.
that I think we see, I don't know if I could say like more so in the first responder fields, but I feel like there's many examples in my Marine Corps career and through other entities I've been involved with where people are getting promoted that we have worker bees for a reason, right?
Yeah.
Hey,
Well, unfortunate, it's like that in the fire service, and my friends that are in the law enforcement, it's very similar across the board. It's people that are, it's people that are are, chasing that next promotion versus people that truly care about their people. And I think it's the people that really care about the people that they work around. Those are the best leaders who I feel like oftentimes are the ones that actually get promoted.
Yeah.
It's kind of putting the what's that saying? It's putting the carriage before the horse.
Somehow I knew that's exactly the phrase that you were looking for too. I I agree. Someone can be amazing at their job, but that doesn't mean that they're going to be an amazing leader of other people. So we see that's a huge piece, right? Is that also people don't often lead. I call it like being a human leader. There's a part where you have to step in and realize that something is not okay, something is not safe. And whatever that safety looks like, it could be physical, emotional safety, whatever the case may be, is this isn't safe for the people I'm charged with taking care of. So that's a whole nother cultural change and shift that maybe in the next lifetime we'll be able to achieve, right? But little bits by little bit. So I love this idea of go to your HR and then have them support you because a lot of places have EAP programs. Did you yourself ever use an employee assistance program in any of the agencies you were involved with?
I actually did, and so I there towards the very end of my fire career, I was called into the chief's office, and as you can imagine, that's kind of a nerve-wracking deal. Especially me, I had started out my first several years just doing great, and uh, towards the end, I was not doing great, and so they said, "Okay, Brian, we want you to use the EAP program, and here's a list of therapists in the area. Just pick one." And so, me not having any idea, I picked, I think, a family counselor, and so it it didn't turn out so well. uh, because I'm describing what the issues were, and he'd asked me what my work day was at the fire station, and I'd explain, we first, we had cutters and spreaders. I'd use the terminology, and he had no idea what I was talking about. And so um, that's the importance of helping, having someone that has been there before guide you through and find you the right fit for your particular situation. So you're not just in this whole thing alone.
That's another great point. I like to think of therapists or like orthopedic surgeons. Just because you're an orthopedic surgeon, you specialize in shoulders. I don't want you doing my knee surgery. And I had an experience where someone close to me, I'm like trying to speak this vaguely, but someone very close to me was seeking care and I got a therapist and I was like, "Hey, I can't be your therapist. I don't feel like that's appropriate. Let's get you care." And the person had some thoughts of suicide. So when I talked to the therapist about this and I saw the therapist's eyes get real big and the
Mhm.
panic set in, I realized this is not the therapy he specializes in. Which is okay to be able to say that and admit that because just like orthopedic surgeons. So I think that's so funny, like you were saying, is I just went to a family therapist. This also goes back to what you said earlier, too, right? Is we want people who can speak our language or know what we've been through. So that kind of peer thing. I see this a lot in the VA system where a lot of veterans want to be paired with other veterans, especially combat veterans. And I think that would be an amazing change in the VA healthcare system. And normally they ask, do you prefer male or female? Right? That's a very common question that gets asked when you're going into therapy. And I think another step that the VA could ask is say, do you prefer a veteran or non-veteran? Because there's some veterans who are like, I want to like escape the military side, the veteran side of things, while others are like, no, I actually need a veteran who can speak the language. I need someone who's deployed, who knows what it feels like, so I can actually talk these things out with. And
Yeah.
that's huge because like you said, they just want somebody to listen, be understanding and validate a lot of what we've been through, right? So it was almost like you go to therapy, you use a lot of language they don't understand. You're like, okay, well now let me spend 45 minutes of my 50-minute session explaining what I'm actually talking about, therefore not actually getting to the root of it.
Yeah. It's like the difference what I've heard, it kind of stuck with me. It makes sense to me. It's like, all the therapists have, it's like going to learn how to drive a car. We all get a driver's license,
Yeah.
but because you have that license doesn't mean you know how to drive a semi truck. You
Yes.
need a CDL to drive a semi truck. So you want to match up with the therapist that's the one that you're needing. And so that's what I didn't do. And then so I ended up going to a 30-day treatment program for alcohol. And I thought it was going to work well. However, I relapsed about a month after I got out. And so I needed 90 days of both addiction therapy and trauma therapy. And so that's what I received, my second go around, and that's what stuck. And now I've been sober for 10 years and it's easy. So,
That's amazing. I think you kind of just brought up another great point is that a lot of people are more likely to relapse, or like when it comes to behavioral health, if someone goes in with thoughts of suicide and then they come out, you're going into, I like call it the perfect bubble. You're going into the perfect bubble. All of your life stressors are over here and you're in a safe environment to try and talk out the things going on. Or like you said, it wasn't geared towards all the things you needed. You needed more
yeah,
than what that initial stay was able to provide you. But that's a huge gap I see in our inpatient care, and not just behavioral health. Throw that out there, healthcare systems in general, but especially like our behavioral health is people go in, they're in that perfect bubble. They have all of this support, and then they go home to those same stressors that they had before going in. And
yeah,
there's not a huge connection. I have a client who went into inpatient care, got involved in a sport, like a recreational sport where he was at. He loved it. The inpatient facility was not in the state he resided in. He went back to the state he resided in, and guess what didn't happen? They did not outreach and get him connected to that same recreational sport that was going on in his own city.
yeah,
He comes home to all the stressors, and what happens? I think he made it a week before he said, well, here I go. All that work for nothing. And I'm like, oh, it wasn't for nothing, right? It's just there's some gaps and there's some holes that we just have to work on filling and educating people. And I'm sure that's a huge thing that Veterans for Life is able to do and step in, because you're helping people get connected to the resources they need, but you're also
mhm,
you're literally sometimes taking people to these facilities and then also picking them up. Uh,
mhm.
what does that level of support look like as far as really being able to help people? How do they receive that? And are you seeing that being a lot more successful for the people that you're working with within your organization?
Well, as far as like the whole process goes, I try to kind of go from a plan to start with, but it very seldom ever goes that way. Um, and it's just hey, do what works step by step by step. And I'll tell you a story about a guy named Nick Thayer, and I have his permission to share this story, and we talk about this story. We still talk all the time. But Nick actually lived in Moore, Oklahoma, and struggling paramedic, in all the ways, drugs and alcohol and mental health. And so me and another volunteer went to Nick's house to pick him up and take him to the airport. We'd already bought him a plane ticket to go down to Florida for treatment. Went to his door, and he was living with his girlfriend at the time, and she met us at the door and says, Nick's not willing to go. And I'm like, oh yeah, I bought his plane ticket. He's going. So it was literally a step by step. It was going and getting Nick out of bed, getting his shirt on, getting his shoes on. He wanted to have a beer out the door. I said, yes, absolutely, have a beer, because I didn't want him to go into seizures on the plane on the way down to Florida. And be honestly, he wasn't going to walk out the door without one. So, and then it's getting him in the car, getting him to the airport, getting him out of the car, which was a big task, getting him through security, and then getting him on the plane. And so it's just a step by step deal. And you just do the very best you can, you know? I wish there was a formula to it, but no, you just do the best you can.
And you made a really good point there too, right? Is that he wasn't comfortable. He wasn't ready to leave. And if his thing was is, I gotta have a beer before I go, you're like, hey, all right. Like if that's what it takes, like get something, feel comfortable, and we're still gonna support you and we're still gonna to get you on that plane. Um,
Yeah.
what are some of the other things? I'd love for you to be able to talk a little bit more about Veterans for Life and share with our audience on some of the things maybe you do, how they can get involved or how they can support you and your organization.
Right now we're most in need of leadership team folks. So just reliable people that have a heart to serve. Um, and that's primarily we're most in need of folks to help build, plan and build events. So that's I would say kind of the biggest need right now. But all the help. So
Well, and one of your events will be coming up soon. It's an annual event that you have, if I'm not mistaken. It's in July.
the Warrior Challenge, yes. We have actually done the Warrior Challenge for 5 years. This year we're taking a break, and we're supporting our friends at that's okay. We're supporting our friends at Inner Circle Mental Health. They are actually hosting a big event called the Challenge Accepted, and that's down near Pryor's Pizza, just south of Norman. So that's going to be awesome, though. So there's lots to do there, and we're excited about it.
That's amazing. And I love that you are partnering with so many different organizations. I'm um I'm sad about the Warrior Challenge this year, but it's cool that you're able to invest in another challenge that's going on and being able to really drive this support home. I want to give you some time if there's something that we haven't covered, if we've missed something that you really want to make sure the listeners learn or hear or something like that. I want to give you the space for that.
Yeah. So what we are doing coming up, well, currently, we just finished our first Veterans Equine Assisted Learning course at Willow Ranch. And I actually went through that course myself. And I just have a huge heart for equine assisted therapy with horses because that's what I actually went through during my 90-day treatment program in Tennessee. So we're kind of stepping back into that at Willow Ranch. And so there's going to be a lot of training between now and September. And then in September, we don't have an actual date yet, but we're looking at two different groups of 8 people. One, we're going to do a morning session and then an evening session for veterans and first responders. But it's phenomenal. I tell people, it's natural. There's no right or wrong way to do it. We go through the safety things. Um, some people actually have kind of get kind of a little bit nervous around the big animals. So we've also got miniature horses there that we also use along with big guys, and it's phenomenal. So yeah, that's something to look forward to in September.
That's awesome. I do remember that. I think that's the day we met was on a horse ranch, right? I know we had mutual connections, and I think that was our meeting. We had our meeting like at a horse ranch, and it was really cool. I know a lot of people who have gotten so much out of it. I worked at a horse barn when I was in high school, and I remember it just being a lot of fun, even just having that responsibility at such a young age, cleaning the stalls and all that was just it was really enjoyable. And I think sometimes that's what people need. They need that community. They need to feel needed. That's something my husband used to say, is like, hey, like I know you're independent and I know you can do these things, but it's nice to also feel needed.
Yeah, and I think a lot of people aren't real familiar with what is exactly equine assisted therapy. So that's one thing I really like to share. So there's different types of equine assisted therapy. One is the equine assisted psychotherapy, and that's what I actually went through previous. And that's with a trauma therapist, obviously the person and the horse. And that's using the horse as a tool in the trauma therapy session. So then another kind is the equine assisted learning, and that's more along the lines of letting the therapy naturally happen in a small group. There's some team building aspect with that. There's a lot of dialogue that opens up through your experiences there as a small group in the horse. And as I tell people, like I leave the ranch feeling differently every time than when I came. And it's not that I even feel like I'm in a bad mood when I come, because I'm in a fine mood, but I leave just feeling different, lighter, and just feeling better about life.
Yeah, thank you for explaining the difference in that because you're right. There is a lot of people who've never experienced equine therapy or never heard that terminology before. And it's a different experience. I think a lot of people might be able to relate to things like dogs. You have the emotional support dogs where you get something out of having another life form that you're taking care of and you're loving on. So I think a lot of that is too when you go to a barn, when you're around horses and those things, you're getting a different connection to life, right? Like you
Yeah.
said, like I could be having a good day and go there, but it's just a completely different connection to life. And we're so caught in like the hustle and bustle and doing a million things at once, like guilty, like I'm the first to admit it. I'm always doing like two, three things at once. So taking that pause, slowing things down is so great for our nervous system. Even if we didn't, even if we had a great day and we didn't realize that our nervous system was already working harder than it should be.
Yeah, it's being totally present in the moment. And I think that really helps. So you're not looking back at the depressing things and the stressful things. You're not looking forward to what's to come. You're just being present there in the moment,
Yeah.
and it's just so much different than an office setting or being inside.
100%. I feel like even just taking walks can make a huge impact on our brains. Is just take a walk, get outside, get outside of whatever environment you're in, whatever that looks like, because it's not always an office behind a computer like you experience as a firefighter. Just being in the station. Sometimes just taking a step and taking a break out from the area that you're in can be huge. Is
Yeah.
there is there anything else that you feel would be really important for our listeners to know when it comes to mental health, behavioral health services for first responders, whether they're a first responder or maybe they're a loved one of a first responder?
Absolutely, yes. I want to encourage people um, to try to find someone that you feel is safe to open up to. I do public speaking, and I oftentimes ask the audience, how many of you in the room, and the room could be, like 10 people or up to 300 people, and I ask them, how many of you in the room have lost a loved one or a friend, someone that's died by suicide? And I would say 85 to 90% of the room raises their hand. And I'll ask them again. So, out of you guys that raised your hand, which is almost the whole room, keep your hands up if this tragedy came at a total surprise to you and those around, meaning this person said nothing. And almost everyone keeps their hands up. So that tells us if we can just get people to just open up to someone, let someone know. And like I say, I've been there, and I'm here to help. I think another misconception is that when we put our problems on someone else, it's a burden to them. But I'm actually here. It's a blessing for me to be able to help, because this is what God called me to do. And it provides a very important purpose for me. So I just want to encourage people, I've been there, and I just want people to open up. It doesn't mean that you have to go to treatment. It just means that please just open up and let someone know that you're struggling.
Yeah. And one of the questions we ask in Assist is we have a little tally mark sheet that we have people mark on and says, hey, if you yourself were thinking about suicide, who would you talk to about? And the astonishing thing is we have this perception in our heads that people are going to go to a doctor or the police or fire or a counselor, go to a professional person who helps save people. But really, people go to people they know. They go to friends, they go to family members or coworkers, someone in their church. Like that's where people say that they will go. So I also think it's important for us to say, like you said, like, hey, I'm here to help. Let me help. And recognizing that you don't have to be a licensed clinician to listen to someone and validate their pain and help them get connected to a resource. I think that's a huge thing is we're just so afraid to say something wrong. We say nothing at all, or we just put it on all the
Yeah,
professionals. They can handle it, right?
yeah, yeah. That's such a good point. But yeah, another thing is if we've been very, very blessed by the community to where we actually offer a scholarship program now. So if any of our listeners are in the Oklahoma City metro area and they're interested in outpatient therapy, but don't have the resources to do that, please reach out. That's what we're here for. That's why we're a nonprofit, and that's where our money goes is to helping people receive the help that they need.
Yeah, that's huge. That's the biggest thing is getting resources, getting knowledge about resources out there, and the financial burden sometimes of that is people are often quick to think, oh, like, $100, $200 for a doctor's appointment. My family could really use this elsewhere, or I really have to pay my rent, or whatever the case may be. So being able to have a resource like yours that says, hey, we have scholarships, we can help supplement this and we can help cover it, whatever that looks like. So I think
Mhm.
that's something great for people to also know as well.
Yeah, for sure.
Now, what would be the best way if somebody wanted to be able to get in touch with you as Veterans for Life, either to donate to you, maybe learn more about what you have going on, or receive services that you can offer?
Yes, thank you. Our website actually also has our email as well. There's a way to contact me directly. So it's veterans for, and that's spelled FOR, lifeusa.org. And I want to encourage people just to go and visit the site. That's where we've got um, some of our fellow veteran support organizations on there. And if you scroll down a little bit further, then you see our treatment partners, and you can virtually tour all of those. And then finally, a way to get a hold of me directly. And if people reach out to me directly, I need them to know that it's 100% confidential. It goes nowhere other than me and you, and possibly the client service rep from the treatment partner that we select to go to.
And that's also a great service alone too. The amount of people that I've helped with just like making that initial call, setting up the initial appointment for them, because when you're so overwhelmed and you're in it, it's so much harder. Right? It's so
Mm-hmm.
much easier to help somebody else like all the time, right? But when it
Yeah,
comes
yeah.
to you and the things that are troubling and bothering you, it seems like this impossible weight while you're carrying this weight for all these other people, just taking this step forward. So I love that you are also able to help kind of be that middleman and advocate for that and say, hey, you can come to me for help. And hey, I can work with a facility and help bring all this together.
Yes, absolutely. Yeah, like I said, it's a blessing. I love when people reach out and just off. A lot of times in reality, it's someone's spouse that reaches out for them or their mother.
Mhm.
I would love to hear from more dads to reach out
Mhm.
because I know it's the pride thing. It's the thing that no, not my son. No, no, he's not struggling. But
Yeah.
I would love for people to reach out and or I'll reach in. Let me know. Can I call them? I'd be happy to. However it works, is just fine.
Yeah, I love that so much. I think It's been great being able to keep in contact with you over the years and see all the different people you've been able to help, your motivating posts that you put on social media. So I'm going to give you a shout out for this. When you're helping someone, you often make a post that says, "Hey, we have someone struggling right now. Can I have people fill up this post to support this person? They're watching." And it's great because you don't tag them in it, but the person can go there and see all these strangers that they've never met saying, "Hey, we're here for you. We support you. You know, look for the light. Let's work together to get you what you need to be able to actually live a life that you're enjoying." So I think that is like this, it's a small, simple thing, but it can mean the world to somebody else. So I really
Yeah.
enjoy that you do that as well.
I'm just happy to.
Well, I know we're coming close to the end of our chat, so I wanted to give you a moment as well. If you have any final thoughts that you want to leave our listeners with, of course, I'll make sure all the links are below so they're able to contact and connect with you as well.
Final thoughts. Let's see. Um, yeah, we're here to help. Veterans for Life is here to help. There's a lot of people that have walked down those tough roads, and we're blessed to help.
Yeah. No, I love it. And I love how much you're going to continue to help and you're going to continue to grow and save lives and save families with that as well. So, thank you so much for coming on and sharing a little bit of your story and sharing what Veterans for Life is doing to help other people. And I appreciate your time, not only in this podcast episode and this chat, but your time that you spend in the community really helping people.
Absolutely. Thank you, Jess.
Thank you. Thank you, listeners, for tuning in. If you found this episode inspiring, please share it with someone you never know who needs more light in their life. May this serve as a reminder that there's always darkness in the world. Do not let it consume you. Always seek the light. Please take a moment to do the good old subscribe, rate, and review. Your support means so much to me, and it helps me spread more light and love. Until next time, be kind, be loving, be human, and don't ever let anyone steal your hope.